Well, greetings and welcome to what we're calling a pint-sized podcast edition of the VHHA Patients Come First podcast. We are pleased today to have Matt Thornhill as our guest. Matt runs the Institute for Tomorrow, which is a think tank. He is one of the many interesting keynote speakers who will be gracing the stage at the upcoming VHHA Annual Meeting, which will be held in late April in Williamsburg. Matt has been called a Renaissance man. He's a talented speaker, an author, a copywriter, a designer, a techno geek. I'm assuming that's a label that he gave himself, and a futurist. He's also really talented at sort of seeing the big picture and connecting the dots that a lot of other people don't see. So we're really pleased to have Matt Thornhill with us today. And Matt, welcome to the podcast.
Well, happy to be here.
Well, thanks again for making some time for us. To start off with, I'd like to just talk about the Institute for Tomorrow. If you could just tell people a little bit about what the Institute for Tomorrow is and what it does.
It sounds like a pretty cool place, and yet we don't predict the weather. I can't tell you anything what's going to happen tomorrow as it relates to the weather. But what we do is we're a think tank. We're owned by a research company based here in Richmond, of all places. Been around for about 50 years. We started the think tank about 15 years ago. And today what we're doing mostly is helping equip leaders today to win tomorrow. And we do that by helping them understand the trends that are impacting their organization and the people that are shaping those trends, be they consumers, patients. And we've done a lot of work in the healthcare space and with hospitals. And we've done a lot of work with hospital systems, not just here in Richmond, like VCU or Bon Secours, but all across the state, Centera, Prince William Health System. I actually just got back from being in Dallas, Texas, where we talked at a healthcare roundtable to about 25 different hospital systems from around the country, helping them figure out what's over the horizon, what do they need to do differently today to be successful tomorrow, and how do they create a winning workplace in healthcare that'll work for them not just today, but into the future.
As I mentioned, you're going to be one of the headlining speakers at the VHHA Annual Meeting, which will be in late April in Williamsburg. I wonder if you could, for folks who are listening and who might attend that meeting, provide a brief sort of snippet or sneak preview about the remarks that you'll deliver when you make your speech there.
Sure. I'm looking forward to it. I will tell you that I've been asked to talk about really how healthcare organizations and hospitals today can win the war for workers. So it's going to be more internally focused, more on the workplace. And really, what's the winning healthcare workplace of tomorrow going to look like? And one of the things we'll do is we'll help you understand the generational dynamics that are happening right now as millennials have entered the workforce. We've got Gen Xers, we've got boomers still there. We've got a very diverse workforce today. So we'll help you understand a little bit about the dynamics that are happening with these different generational mindsets interacting in the workplace. And then we'll talk a little bit about some of the things that you need to be doing to make sure you can keep the people you have and be appealing and attract new workers. So things like looking at your culture, what's right with your culture, what needs adjusting, is your culture aligned with modern culture? A lot of us today think that the fact that the work culture has changed has been driven by those millennials, because those millennials came in and they don't seem to be wired like anybody else, and that they've changed the work culture. The truth of the matter is that most work cultures we find today are lagging modern culture. It's 2018 and everybody, workers of all ages, want a work culture that's aligned with society and everything else. And what we're finding is a lot of organizations are still operating like they did 10 years ago or even 20 years ago. They just haven't updated their rules. They haven't updated their policies. They're just not being flexible and adaptable or open and transparent. So we'll talk about all of those things and help the audience understand what are some of the key things they need to look at, what are some of the key things they need to address and change, and how do they make sure that they are a desirable workplace. The competition for workers is going to get harder and harder, especially in this economy where we've got a very low unemployment rate. In fact, we actually have more open jobs than we have people for the job. And healthcare is going to be an expanding, growing, category for the next decade. Where are we going to get workers from? Well, we're going to have to take them from someplace else. So how do you make yourself appealing so people will come? So we'll talk about all of those things and more in April in Williamsburg.
Well, I know that I'll be there, and I'm actually looking forward to your remarks based on that preview. For folks who are listening to this who are interested in attending the VHHA annual meeting in April in Williamsburg, you can visit our website, www.vhha.com/programs, to find out information and register. And since I did a plug, Matt, anything you'd like to quickly plug?
Sure, they can kind of meet me and learn more about the organization by going to institutefortomorrow.com.
Matt Thornhill, again, thank you for taking the time and for joining us for a pint-size edition of the Patients Come First podcast.
My pleasure. Looking forward to seeing you in April.